Hospital efficiency depends on the unsung heroes working behind the scenes, the environmental services teams who ensure facilities are clean, safe, and ready for patient care. Our next guest, Alan Cooper, co-founder and CEO of ReadyList, is revolutionizing how these critical teams operate within healthcare facilities. With over 17 years of healthcare technology experience through Ancilla Ventures, Alan brings a unique, hands-on approach, often getting certified alongside the very workers his software serves. Driven by a passion to empower the underdog and create accountability through technology, Alan has built ReadyList into a mobile platform that transforms hospital EVS operations. Join us to discover how ReadyList's innovative solutions are streamlining room turnovers, enhancing cleaning protocols, improving operational efficiency, and ultimately creating safer environments for both patients and staff. Let's go.
Welcome to Passionate Pioneers with Mike Biselli, where we highlight and speak with the innovators, the game changers, and the pioneers who are deeply passionate and relentless in solving the problems our world is facing today. This is your opportunity to connect with and learn from these leaders and to support them on their mission. Perhaps they will soon be hearing your story as well. This is Passionate Pioneers with Mike Biselli. I look forward to having you on this journey with us.
Hi, Alan. A big welcome to our podcast. I'm so excited to have you on today.
Thanks for having me on, Mike. It's been a pleasure.
Well, given your deep expertise in healthcare software development and your passion for empowering the behind-the-scenes hospital workers through ReadyList innovative solutions that improve operational efficiency while maintaining the highest standards of cleanliness and patient care, I'm honored to have this conversation today. But before we dive in, a bit of housekeeping. While listening to any of our episodes, please take a moment to subscribe to the podcast so you will automatically receive episode updates in your podcast player. Simply search Passionate Pioneers with Mike Biselli in Apple Podcasts, Spotify, or wherever you listen to your podcasts. And lastly, please visit the bottom of the episode notes to connect with me on LinkedIn and X in order to further the conversations occurring on this podcast. All right, Alan, it's almost time for our community to learn how you and the ReadyList team are revolutionizing how hospital environmental services teams operate with a mobile-friendly software that guides them through best practice cleaning and room preparation protocols. But first, what's that one piece of advice that you would give to others who are passionate about reimagining the health of our world?
I think the biggest thing that I've learned for myself is to be a part of it and, really embrace yourself into the world. I think there's many entrepreneurs out there that have great ideas, but they don't know and feel what those that receive their benefits in real life. So what I try to do is put myself in their shoes as best as possible. I try to embrace the people that are actually experiencing our software by being there implementation wise and the like. And at the end of the day, I even go so far to try to get certified in some of these areas to be as close to it as I can possibly be without actually doing the work itself. So for me, if you're passionate about whatever it is you're going to deliver in the healthcare space, don't pretend that you know more than they do. They'll know always more than you do. So empathize and try to embrace their world.
Oh my gosh, Alan, you are speaking my language. I absolutely love it because you know as well as I do, right? It's one thing to think that you have a product or think that you have a technology that's helping solve for a problem, but you just don't know until you actually get out there. I always love to talk about get out of your proverbial office and put those boots on the ground, get out there, get next to the end user. Alan, I also love what you just mentioned that you'll go in and get certified for whatever that might be. For instance, I know we're going to talk a lot about, environmental services and sterile processing and those aspects of a hospital. Long ago, I used to work alongside those folks, so I know exactly what you're talking about. So important to deeply understand what their pain points are, what their struggles are, and how best to go solve for it. Alan, do you also encourage not only yourself, of course, but the rest of your team to do that? I think it's such a great piece of advice.
I really do. I mean, every implementation, if a software engineer has not been part of an implementation by literally going to the site, we usually bring them along. And that allows them to really kind of have hands-on experience and observing the software for those that are actually using it. And ask the questions, what's working well? What could work better? And not pretend that it's going to work for everyone. So we're small enough as a team and agile enough to be able to respond to any adjustments that's needed to make sure that the actually software is being maximized to the level that works for that particular hospital.
Alan, I could make this an entire podcast episode in of itself off the advice that you just gave because I absolutely love and subscribe to your methodology and your passion for getting into the weeds, if you will, getting into that experience of that end user. I absolutely love it. Last question before we really dive into the heart of the matter today. In regards to being there shoulder to shoulder with that end user, to be in their environment of where they're working with your technology and your software, what's their response been like? Because be honest with you, a lot of companies don't do this. What has their response been, these end users, of you actually being there, working alongside them, being in their experience, being in their space to better understand how they use your technology? What's their experience been like with that?
It's funny you say that, because normally, like, one of my team members kind of go out there first, do some of the training, and then I'll usually go out there a few days later during the implementation itself, and just observing how the people on the floors are responding to, like, my colleagues that are already there as if they're peers. It's quite amazing that they're kind of joking around. They're kind of like embracing us as we're part of their extended team. And then when I get there, like within hours, I feel like I'm also part of their peers group as well, because frankly, we are. Like, we work with each other to improve both of our lives, whether it's us helping improve our software or us helping them improve the way that they use our software. So it's pretty awesome.
That is so cool. I absolutely love it. Well, of course, Alan, you guys have been at it now with ReadyList, and of course, a bunch of your other organizations, but specifically with ReadyList on what we're going to talk about today. You guys are almost celebrating your 10-year anniversary with the company, with ReadyList, and what you've built to serve environmental services in the healthcare industry. We're going to talk about all of that and more, and where everybody in this community can plug in and continue to learn more about ReadyList and where they can bring this technology to their health systems as well. We're going to unpack that and more after we get back from thanking our community champion sponsor.
Healthcare faces a paradox that echoes through generations. While the current practices that help heal patients today are vital, it is crucial to evaluate them through an environmental lens. OSHA's Responsible for Tomorrow initiative is a collection of interviews featuring influential thought leaders and industry experts like you, who share their sustainability strategies, insights, and provide valuable perspectives from diverse industries to inspire innovation within the healthcare sector. OSHA invites you to join this journey. Want to share your sustainability story? OSHA is actively looking for partners to highlight the important and inspiring work being done around the globe. Check out OSHA's Responsible for Tomorrow initiative and series at OSHA.com. That's OSSUR.com. Or visit the episode notes and click on their link. Together, and with OSHA helping lead the way, let's all be responsible for tomorrow.
All right, we are back with Alan Cooper, co-founder and CEO of ReadyList. Alan, thank you so much for really setting the stage on the front end, getting out there, you and your team, working shoulder to shoulder with the end users of your technology at ReadyList. Well, and now we are going to really dive in deep on who exactly is ReadyList, how the company came to be in the first place, as I mentioned on the front end, almost 10 years at it now. That in and of itself is a huge feat, especially in this very, very complex and difficult industry to innovate in, which is called healthcare. It's an amazing feat in and of itself. So we're going to discuss that journey of how it all came to be, where you guys are at today. And of course, Alan, you're in that captain's chair. You're seeing a lot of things that our community definitely wants to know about in regards to where are things heading for the industry kind of as a whole. And of course, where is ReadyList going to be in that kind of future state as well? So we'll discuss that. And then, of course, we can't get you out of here until we can figure out ways to help you and the ReadyList team as well. But of course, Alan, let's go there first. Take us behind the scenes. I know it's been a while since this company was founded, but share those aha moments. Share it with us. Where did this all come to be in the first place? How did ReadyList become ReadyList?
Yeah, great question, Mike. So if you kind of start a little bit of, I got into technology out in Accenture days back a long time ago. And I always knew that I kind of want to have my career related to that space. And as I kind of evolved into that journey and company, I realized, I need to kind of go a little bit deeper in my entrepreneur hat and kind of step back and kind of what got my MBA. After that, I really started to realize I really wanted to work for a small company, or actually in some ways a part owner of a small company. And that's kind of where I helped kind of bring that to life with the partners at the time called Intel Ventures. And during that journey where we're innovating technology software for the healthcare industry, years after, we were approached by one of our colleagues from Accenture days that said, we have a gap in the industry. One of the hospitals we're opening up in California that we really want to evolve and elevate the space of the environmental services and facilities area, where we want to get rid of paper, we want to get rid of these checklists, we want to get rid of all the manualness in this area, and we want to have an actual foundational platform for our department. And they wanted to go beyond just what they get out of their EHR. And so they approached us with this idea. And part of what we do for Ancilla is we kind of bring ideas to life. So we brought this idea to life and we formed ReadyList as a product and as a company. And we spun it off. And that has its own living, breathing entity itself. And we've been kind of growing since then.
That's an amazing story. And of course, it's really how it comes to, these things come to bear sometimes, is hearing those pain points of those end users. And you also mentioned Ancilla Ventures, of course. How has your now 17 plus years of experience with Ancilla Ventures informed your approach to building ReadyList software solutions?
Yeah, great question. We've gone through many journeys of how we kind of build software in the first place, whether it's protocols of projects and how do you actually do a project, the testing and the like. And we've constantly refined that year over year. And we do Scrum and Agile, and we find that actually aligns really well with software as a service, because we're constantly getting feedback from our clients. And instead of like having a 6 to 12 month project, we have like these biweekly sprints that, we have monthly goals, and it can easily pivot based on the demands and requirements from our clients. We're able to easily shift and pivot based on the direction of our clients, and always making sure we do the most important things first. We try not to do too much of the shiny objects. That's the other thing that I've learned through Ancilla into ReadyList is not every idea should be implemented. We like to get that validated. So anything we do incorporate into our products, we want to make sure that many are going to benefit from it. If maybe there is a very important one for our client, we'll do it for them, set that out for them. But we try to make sure we don't have such a customized software that it's hard to manage and to bring that agile approach moving forward.
And let's continue to go back to kind of those early days of ReadyList. You mentioned you had Accenture and others kind of approach you about a facility out in California that was looking to bring this technology to the EV department, Environmental Services Department. But of course, and you mentioned this right at the very beginning of getting out there, hearing the feedback from the end users, that was an N of one, that facility out in California. Did you and the team also go and validate with others across the industry, maybe in other markets as well, to really better understand what that problem is before truly launching ReadyList? And if so, what was that experience like?
Yeah, it's a great question. To be frank, we did not. So if you want to talk about lessons learned, that was one of the things that we learned, where I think our core product, thankfully, does have a market, and we didn't test it beyond the one, but thankfully it worked out. Well, the client also had other ideas that we did build, and guess what? We didn't validate it, and guess what? It's not being used. So there's a lot of development time that unfortunately was kind of wasted in some ways, that could have been redirected on something that if we got validated across the market, we probably would have not done some of those modules that are right now obsolete and they're not even being used. So do we do that now? Absolutely. Like now when we bring things to life and before we start to kind of like really make it mainstream, we will ask our current clients, even if they don't want it, like right now, maybe they're just not ready for it. We'll ask them, like, is this something of value to them? And if so, why? Like, what do they currently have now? And is this something that actually will be better for them if they are ready for it in the future? And so we do validate that in the last few years for sure. But that is a lesson learned that unfortunately you have to go through it to experience that was not a good idea. Let's not do that again.
Well, you mentioned a little bit ago that might have been a little bit of a waste back then in regards to not validating, but maybe not so. Maybe it was one heck of an investment, because that lesson learned is still living on 10 plus years now down the road from what you learned and experienced many years ago of not validating. So great lesson learned for our aspiring entrepreneurs that are tuning in to really get out there and validate, test and validate, test and validate in regards to what you're thinking and what you think that the market needs versus what the market actually is really signaling of that need out there. So a great learning lesson. Thank you for that, Alan. Let's go ahead and springboard a little bit into current state. Obviously, it's been a long journey, almost 10 years into the organization. And I'm sure things have changed along the way. But for today, as we record this podcast, who is ReadyList?
Yeah, ReadyList is basically a product that it's meant to help support the facility environmental services area. Do two things. One is to create accountability for the team. And there's a good byproduct of that accountability is you elevate your team, right? So the team is now empowered, where before, if you don't have these checks and balances and you don't have these set expectations for your team, it's hard to empower them because everyone may just lead the way that they want to go. And now you have a little bit of a scattered approach where if you give them some guidance, some frameworks, and a process and a workflow to follow, and you have a tool like ReadyList to help kind of support that, it's a lot easier to empower your staff. And that to me is one of my passions, to be honest with you, is to empower people. There are so many people out there that want to be empowered, but they're not given that chance. And this really goes in any space. And I think even for like the EVS department, there's a lot of individuals there that have really good ideas. They want to actually grow in their careers. And this allows them to really do this is by giving a structured approach, a framework, if you will. And we kind of provide that to them. And it really makes it easier for supervisors and managers to empower their team. And honestly, like I always think it's always better to grow within than to always cherry pick outside the organization. I think it's easier. I think you build culture better that way by trying to bring in and elevate people and create excitement. And people that get elevated and empowered are way more accountable. So everyone's life is better by really trusting your people and providing them the necessary tools to be better.
And for these health systems previous to ReadyList, I always love to say in healthcare, it's a lot of status quo. This is how things have always been done, right? What was a healthcare system status quo prior to adopting ReadyList? Maybe you can share a bit there.
A lot of it is either like manual paperwork, Excel spreadsheets, or they're not doing it. Those are typically the three. There are obviously EHRs and alike that have extensions of what they have. But to be honest with you, EHRs are meant for serving the patients. They're not meant for environmental services area to kind of help them guide their department. They do good at alerts to let them know, hey, there's a discharge for a room, go clean it. Fantastic. That's really good for operational purposes to get a patient out and in a very timely manner. But it doesn't go into the nuts and the bolts and the gritties of what's expected of any of these cleaners. And I think that's where we provide that value is we have a very set expectations of what the protocols are to do a very effective and efficient, safe, disinfected clean. And that's like the core of our product. And then we have other things that we extend from it, like floor care. How do you set up a machine? Like a lot of these machines nowadays, they go from very rudimentary, basic to very elaborate, self-driven. And if you don't set these things up correctly, you could either damage the floors that you're trying to clean, scrub and the like, or you could damage the machine. Either one of those are not great for the hospital. So hospitals, basically, their goal is to try to be at least neutral in budget. And they don't want to go into loss because that's very easy to go down. These are just opportunities for them to make sure that this does not happen. And it doesn't put these poor employees in an awkward situation where they're expected to do something, but they don't have a lot of guidance and control to be able to make sure they're doing it right. So at the end of the day, I think our software helps kind of do that for them.
Let's stay on a little bit on that topic in regards to how the software is helping, et cetera. Alan, can you share a success story where ReadyList software made a measurable impact on a hospital's efficiency or patient outcomes?
Yeah, one of the things that I was actually talking to a client this week about was discharge and turnovers in general. And we were kind of just talking about like, how long does it take to actually do a discharge clean, from start to finish? And how long did it take before ReadyList and how long does it take with ReadyList? And he kind of like provided us an example of one of their hospitals that like had 500 beds is that it would take them about an hour and 15 minutes to do a discharge clean. With ReadyList, they can do it in 45 minutes. Now, the goal is not to do that in 45 minutes. It's to do it in 45 minutes with that same quality. The other thing that they typically reference that usually isn't documented very well is you can do a discharge clean in an hour or even 45 minutes for that matter. But when you do an inspection, if they highlight deficiencies in that turnover clean, Well, guess how much more time is now added? You have the supervisor's time of actually addressing the issue, or they're bringing in that cleaner back to do it. So really that time is whatever it is, an hour plus whatever time is taken to actually do the clean correctly with those deficiencies. So to me, like, I feel like that's a really good success story. I think the other one is really just onboarding, so when you bring in new employees, and unfortunately this area sometimes has high turnover depending on the area and the like, you want to be able to train the individuals in a way that it's repeatable and they have something they can lean on, right? So they can lean on our tool because it actually tells them what's expected of them in a workflow that allows them to be efficient, and then it allows them to repeat it. And if they ever question themselves, they can go back to the tool. The tool will have pictures, the tool will have information that helps provide them the necessary things as they're onboarding to do it faster and more efficient. And then that gives back time to the supervisor where they don't have to do training for 2 or 3 weeks. They can actually do it in a less amount of time, and then also rely on the software to reinforce these best practices for them. So then it's ingrained in them. And then they're using the tool more efficiently, because now instead of using the tool like itemizing it down line over line, they're actually going back after they've done the clean and validating and verifying they actually done what was expected of them for that particular turnover.
Oh, very cool. Of course, Alan, you know as well as I do, we have an area of this industry, healthcare, that has a lot of regulations and standards around it, which is fine and is obviously very important. But in regards to being able to balance that with ReadyList, how are you and the team taking this approach of compliance when you're thinking about infection control and adapt to that rapidly changing healthcare, regulatory and standards body?
Yeah, so there's 2 ways we do that. One is we're really glued to the hip to our clients. So they themselves are always in the know, whether it's them doing their own research and receive this information from organizations like AHE and providing best practices, or even their vendors. A lot of the vendors that they get their products from educate the departments on what are some of the new regulations, because, they have their own needs of selling that product, and they want to make sure that they're also solving the correct problems as well through the clients. And then we also belong to AHE as an organization. So we also get the same information, and we can also do our own digging and get ahead of it. And chances are the clients are going to know what we know, but it's always good to be able to receive the same information on both ends, and we kind of cover each other, which is really kind of nice. So then the software itself is always up to date to the standards that's required to do their job.
And let's also turn a little bit future state as well. Things are rapidly changing in healthcare and will continue to do so. The pace at which technology and innovation is coming to healthcare is moving as fast as I've ever seen in my career, which I'm a big fan of. But of course, we need to keep that in balance of where, stakeholders are and where things are today and where we are going forward tomorrow in regards to us being innovators and builders of technology. So, Alan, looking ahead, what innovations do you see coming to hospital operations technology, and how is ReadyList positioning itself for these future developments?
Yeah, I think the biggest thing I've been seeing lately, and no surprise here with what's going on with AI and the like, but one of the things is self-serving, and I think AI is an element of that, but like self-serving, and I go to a hospital, I'm either a patient or a visitor, right? And I want to be able to communicate to the people that are going to fix my problem. And I think that self-serving, instead of, talking to the nurse, talking to the administration, there's technology out there with QR codes that you can actually scan and be able to communicate directly to those that actually fix your problem the fastest, because they're closest to it and they're the right people to actually address your problem. So that example, we actually built a module called Rapid Service Responder to kind of like basically address that gap. And the gap there is, if I have a restroom that has situations and issues, and we see this in the travel industry, right? So when you go to an airport, you will see some buttons out there that they click and say, are you satisfied or not? Well, we just took it one step further, because one is we don't believe people should be touching those types of things, especially in healthcare. Like, you want to be able to be as germ-free as you can. So use your own device. So QR code it, and then the QR code brings up a very simple form for a patient to actually say what's wrong, tell us what it is. And then what this thing does is smart enough to actually tell the closest cleaner to that situation to address it right away. It'll alert their phone, and then they can actually go, once they're done with what they're doing, and address that situation. And what that does is it creates efficiency in workflow process that isn't there now. Normally what happens is the patient or visitor goes to administration or nursing goes and tells the supervisor goes and tries to either address it themselves or they go to the cleaner. So we just now took away a lot of individuals that could have been fixed right away by the person that actually knows how to fix it and they're the right person to fix it. So streamline that process, all because we're empowering our patients or visitors to be able to communicate to us directly.
That is super cool. And talk about speed to getting those issues corrected and solved. And then, of course, what does that mean for everybody else experiencing that facility? I got to imagine the satisfaction and the experience goes up and up because things are getting taken care of much more quickly. What a really cool innovation. And so you're seeing those things on the horizon on self-service. And of course, you mentioned AI or otherwise. How do you see facilities changing and where do you see ReadyList continuing to help support those needs of a facility? Are things changing as we think through what is even a hospital? What does that look like as well?
You know, it's funny, as I was talking to someone yesterday and they were just talking about how robots are going to be being leveraged on nursing types of actions and obviously maybe not treating a patient directly. You know, maybe it will come someday, but I still think you need a little bit of human interaction. Like for me, until robots can feel and empathize, you know, I think nursing, that staff is so critical to a patient satisfaction and the care itself. But there are some activities that nurses have to do that if it can be done by a robot or similar, or even like AI for that matter, could do certain things that are maybe not patient-centric, but it relates to the experience. Why not leverage it? Because then that allows the nurses to do more of the direct care to the patient and less of the background noise that is required, but isn't directly satisfying the patient. And I think giving more time to that face-to-face for a nurse or a provider, I think is so critical. So for me, like technology should be embracing and pushing more to that human interaction and leverage the technology to take away the things that maybe can be done without impacting that experience. My personal view is, I don't care what happens with technology. I find it hard to believe that you're going to completely take away the human intervention there. I think it's just too important. I mean, we're people, and I think it's just, we have that human side of us that I think can't be ignored.
Yeah, I'm going to jump on that soapbox with you for a quick moment. I'm a firm believer of that as well. We're not going to rewire human DNA of hundreds of thousands of years overnight. That human connection person to person is absolutely just at core of who we are as people. However, to your point, what I love and see with technology innovation and some of these things that are coming to healthcare is, like to your example around nurses, how do we either alleviate or release administrative burden and get that out of a nurse or clinician or that care provider, whoever that person is, get that out of the way so they can get back to that human to human connection and do what they are best trained and most passionate about. So there's no reason why we can't use machines or robots or otherwise technology to get back to that. And to me, that's what's most exciting at the end of the day. So I'm right there with you, Alan. Let's go ahead and throw that crystal ball back on the shelf for now. Let's bring it back to current state. We have an incredible audience rallied around this podcast. Love to help our guests out. What's one problem, need, or question that you and the team have that our community can be helping you with?
I think it's just that constant feedback of when you're either as a patient or a visitor or the like, what has become one of your more frustrating points with those experiences? You know, always hearing from those that are actually in the hospital itself, I think is so valuable because we talk to and work with a lot of the personnel in the hospitals, which have amazing visibility to this. But getting that even deeper from the patient or the visitor, it just helps either validate what they're seeing as well. And then it helps making sure we package something up that's really going to ultimately create a safe environment for the patients. And that goes like with things that are literally like spills on the floor where they can hurt themselves to the infection portion of it. So I think both of them are very critical to ensure that everyone that needs to be treated at the hospital can do it in a way that they feel safe, they feel comfortable. It's kind of like, in my opinion, going to a hotel that you really love to go to, and you're getting that pampering that you want because you're not going there typically to be pampered. But when you are in a situation where you're at the bed and you're kind of waiting or you're after a procedure, don't you want to feel as best as you can? My goal is to make sure that can happen.
Well, in order for our community to have those conversations with you and explore these topics that are very important, how do they get a hold of you, Alan? Social media handles, contact points, websites, or otherwise? How do they track you down online?
The biggest thing is ReadyList.com. That's our website, or LinkedIn, Alan Cooper. So either one of those are great ways to get a hold of me. And I would love to hear from people out there on any of their challenges or positive. Like, I always like to hear positive too. Like, both are really good for us to hear. So,
well, for our community that is tuning in, simply scroll on down into your favorite podcast player where you're listening to this episode. There will be those contact points online, or you could head over to our free global online community at passionatepioneers.com. There will be a post for Alan's episode where you can also leave comments, feedback, suggestions, or otherwise. And of course, grab those contact points online again over at passionatepioneers.com. Well, Alan, a very important topic we're discussing today, of course, and one that you guys are extremely passionate about, experts in, and really continuing to help move our healthcare industry forward. But of course, before we say our goodbyes, I do have one more piece for you. It's a fill in the blank. I'm a passionate pioneer because
I love to evolve and grow people. I'm a people person. I love to see them be a better person because I helped them get there.
Absolutely love it. Well, you and the team at ReadyList are doing exactly that. Thanks for all that you do and all the innovation and all of the opportunity you are bringing to our industry to make us better. It is certainly appreciated. And thank you so much for taking the time to tell the story about ReadyList and your background here on our podcast, as I know how busy things can get. I appreciate you taking that pit stop and being with our community today. Again, Alan, thank you so much for taking your time to being with us today.
Thanks a lot, Mike. Appreciate it.
Thank you for joining us today on Passionate Pioneers with Mike Biselli. We'd love to hear your feedback about the podcast so we can continue to improve this community and to further support the pioneers being featured. Lastly, please take a moment to subscribe to the podcast and invite your friends and colleagues to join us. This is Passionate Pioneers with Mike Biselli. I look forward to having you back with us during our next episode.